Welcome to Dr. Balga's podcast for the Curious Doc. Today is February 1st, 2026. This video is on a Cell Press article published January 27, 2026, open access, titled A Triple Node Heart-Brain Neuroimmune Loop Underlying Myocardial Infarction. Myocardial infarction activates coordinated neural and immune signaling between heart and brain, driving adverse remodeling. They used a murine permanent LAD ligation model, follow up to 14 days. They used 5 to 19 mice per group depending on the experiment. Techniques used single cell RNA-seq, spatial transcriptomics, chemogenetics, viral tracing, EKG, and echo. They use two-tailed t-test or one-way ANOVA with two key corrections. Data was shown as mean plus or minus standard error of mean. What did they find? They found that TRPV1 vagal sensory neuron ablation improved ejection fraction, reduced infarct size, and normalized EKGs. P-values less than 0.05 to less than 0.0001. Paraventricular nucleus angiotensin II-81 receptor neuron inhibition replicated cardiac protection and restored autonomic balance. Superior cervical ganglion interleukin-1 beta blockade reduced sympathetic hyperinnervation and inflammation. Limitations: they used a mouse model. Additional immune mediators and dorsal root ganglia pathways were not fully explored. Key takeaway: myocardial infarction is driven by a tri-node neuroimmune circuit of the sensory vagus, the hypothalamus, and sympathetic ganglia, offering new therapeutic targets. Clinical pearls: post-MI injury is not purely cardiac. It's a systems-level neuroimmune disease. Targeting neuroinflammation may complement beta blockers and renin-angiotensin system inhibition. IL-1 beta signaling has actionable relevance beyond myocardium. Autonomic imbalance is both a marker and a mediator of adverse remodeling. Related eponyms and concepts include the Bezold-Jarisch reflex, which is the cardiac sensory reflex mediated by vagal afferents. Hit pause to read more of the concepts. For more details on this paper is open access in Cell. Fascinating paper. Go ahead and access it. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.